Hi all, welcome to another video of NS Pharma. Today we will see important multiple choice questions from the Pharmacology chapter Beta-lactam antibiotics. Beta-lactam antibiotic. So this is very important multiple choice questions. You can expect these questions for the coming competitive exams or for the pharmacist. If you are watching this video first, then please, if you didn't subscribe my channel, please subscribe the channel first of all, and also press the bell button so that you will get the notification regarding new videos whenever I upload them. So we will move to the first question. The beta-lactam antibiotic include the following. Beta-lactam antibiotic include the following. Options are Cephalosporins, Monobactams, Carbapenems, all of the above. The correct answer for this question is all of the above. That is Cephalosporins, Monobactam, Carbapenems, all are coming under this class, beta-lactam antibiotic. And this penicillin is also coming under beta-lactam antibiotic, even though it is not mentioned here. So we will move to the next question, question number 2. The characteristic features of penicillin G. Penicillin G is option A, it is unstable in aqueous solution. Option B, it is antibacterial. Its antibacterial action is unaffected by pus and tissue fluids. Option C, it is equally active against rusting and multiplying bacteria. Option D, both A and B are correct. The question is the characteristic feature of penicillin G. Options are, it is unstable in aqueous solution. That is correct. Option B, it is antibacterial action is unaffected by pus and tissue fluids. That's also correct. Option C, it is equally active against rusting and multiplying bacteria. No, that's wrong. Here the correct answer for this question is both A and B are correct. Option D is the correct answer. Now we will move to the third question of the video. The penicillin G preparation with the longest duration of action. The longest duration of action, penicillin G preparation with the longest duration of action is options benzathine penicillin, sodium penicillin, potassium penicillin, procaine penicillin. The correct answer for this question is benzathine penicillin. Benzathine penicillin has got longest duration of action in case of penicillin G preparation. Now the fourth question of the video. The most important reason for highly restricted use of penicillin G injection in present day therapeutics is because of its narrow spectrum of activity. Penicillin G injection is highly restricted during nowadays. Why? Because of its narrow spectrum of activity or its potential to cause hypersensitivity reaction. Option C, short duration of action, neurotoxicity. The correct answer for this question is it's because of it causes hypersensitivity reaction. That's why nowadays penicillin G injections are highly restricted. Question number 5. Benzathine penicillin injected once every 4 weeks, that is almost in one month for 5 years or more in the drug of choice is the drug of choice for. The question is benzathine penicillin, that is penicillin G longest acting penicillin, is injected once every 4 weeks for 5 years or more is the drug of choice for. Option A, a granulocytosis patient. Option B, prophylaxis of bacterial endocarditis in patients with valvular defects. Option C, prophylaxis of rheumatic fever. Option D, treatment of anthrax. This regimen, that is once every 4 weeks for 5 years of benzathine penicillin injection, is the drug of choice for prophylaxis of rheumatic fever. The correct answer is option C. Next question. Which of the following is not a semisynthetic penicillin? Not a semisynthetic penicillin. This one we are studying in the classification of penicillin that we will see in the last section of a video. last part of the video. Once the MCQ is over, I will discuss the important points regarding this chapter. So in that you can we will discuss the different classification, different classes of penicillin. Here the correct answer for this one, that is, which of the following is not a semisynthetic penicillin? Option A, Procaine penicillin. Option B, Ampicillin. Option C, Cloxacillin. Option D, Carbapenems D. The correct answer is Procaine penicillin. Sixth question. Option A is the answer, Procaine penicillin. Now the seventh question. Choose the semisynthetic penicillin which has an extended spectrum of activity. Choose the semisynthetic penicillin which has an extended spectrum of activity against many gram-negative bacilli and is acid resistant but not penicillinase resistant. Option A, Cloxacillin. Option B, Amoxicillin. Option C, Phenoxymethyl penicillin, that's penicillin B. Then piperacillin. Has got extended spectrum of activity. Then it is acid resistant but not penicillinase resistant. The correct answer for this question is Amoxicillin. Amoxicillin is the correct answer. Now we will move to the eighth question. Features of Phenoxymethyl penicillin, that is penicillin B, include the following. Option A, it is acid stable and orally active. It is antibacterial. Its antibacterial spectrum is similar to that of benzyl penicillin. It is used for less serious penicillin G sensitive infection. Option D, all of the above. Phenoxymethyl penicillin is acid stable and also it is orally active. Option A is correct. Its antibacterial spectrum is similar to that of benzyl penicillin. That is also correct. Option C, it is used for less serious penicillin G sensitive infection. That is also correct. Here the correct answer for this question is option D, all of the above are correct. Now we will move to the ninth question. The most frequent side effect of oral ampicillin. What is the frequent side effect? Option A, nausea and vomiting. Option B, loose motion. Option C, constipation. Option D, urticaria. We know that this ampicillin causes loose motion normally. So the correct answer for this one is loose motions. Option B is the correct answer for this one. Now we will move to the 10th question. Select the semisynthetic penicillin which is not acid resistant. Option A, Phenoxymethyl penicillin. Option B, Ampicillin. Option C, Carbapenems. Option D, Cloxacillin. We know that Phenoxymethyl penicillin, we already discussed, it is acid resistant. Option B, Ampicillin, is also acid resistant. Option D, Cloxacillin, is also acid resistant. The last option, that is option C, Carbapenems, is the correct answer here, which is not acid resistant. 11th question. Piperacillin differs from the Carbapenems in the following respect. Piperacillin differs from the Carbapenems in the following respect. Option A, it is more active against Pseudomonas aeruginosa. Option B, it is active against Klebsiella as well. Option C, it is acid resistant. Option D, both A and B are correct. 11th question. Piperacillin differs from the Carbapenems. The correct answer is both A and B are correct. That is, it is more active against Pseudomonas. Piperacillin is more active against Pseudomonas aeruginosa compared to Carbapenems. Option B, it is active against Klebsiella as well. Piperacillin is also active against Klebsiella. So we will move to the 12th question. Clavulanic acid. Clavulanic acid is combined with amoxicillin. That is, amoxicillin clavulanic acid combination, because it kills bacteria that are not killed by amoxicillin. It retards renal excretion of amoxicillin. Option C, it counteracts the adverse effects of amoxicillin. Option D, it inhibits the beta lactamase that destroy amoxicillin. We know that beta lactam inhibitors, that's clavulanic acid. So here the correct answer for this question, 12th question, is it inhibits beta lactamases that destroy amoxicillin. So why clavulanic acid is combined with amoxicillin? Because clavulanic acid clavulanic acid inhibit beta lactamases. It inhibits beta lactamases which destroy amoxicillin. Question number 13. Which of the following is a second generation cephalosporin? It's a second generation cephalosporin that is highly resistant to gram-negative beta lactamases and cures penicillinase positive as well as negative gonococcal infection by a single intramuscular dose. Question one more time I will repeat. The following second generation cephalosporin that is highly resistant to gram-negative beta lactamases and cures penicillinase positive as well as negative gonococcal infection by a single intramuscular dose. Options are cephaloxime, cefuroxime, cefoperazone, then ceftazidime. The correct answer for this question is cefuroxime. Cefuroxime is second generation cephalosporin and that cures penicillinase positive as well as negative gonococcal infection by the IM single dose. 14th question. Select the third generation cephalosporin that can be used only by parenteral route. Select the third generation cephalosporin. Select the third generation cephalosporin that can be used only by the parenteral route. Options are Cefpodoxime proxetil, option B Ceftizoxime, option C Ceftibuten, option D Cefixime. Third generation cephalosporin that can be used only by parenteral route. Option A Cefpodoxime proxetil, option B Ceftizoxime, option C Ceftibuten, option D Cefixime. The correct answer for this question is Ceftizoxime. Now the 15th question. Select the fourth generation cephalosporin among the following. Select the fourth generation cephalosporin among the following. Option A Cefperom, option B Ceftizoxime, option C Ceftazidime, option D Cefuroxime. The correct answer for this question, that is fourth generation cephalosporin, is option A Cefperom. Cefperom. I know for some students it's very difficult to by heart this one first generation, second generation, third generation, fourth generation categories of cephalosporin. So for by heart this one we have some tricks regarding this one for finding out first generation, second generation, third generation, fourth generation classification. By checking the name of the medicine name, by checking this name, we can find out which it is coming under which class, which generation. For this technique, I will discuss after the MCQ. In the last, we will discuss it. By that technique, you can easily understand it is coming under which generation. That is, here it is. Question is asked for the fourth generation cephalosporin. The options are coming like this. So by seeing the name of the medicine, by checking the name itself, we can see which generation it is coming. That we will discuss once the MCQ is over. Now we will move the 16th question. Choose the correct statement about cefepime. Option A, it is a fourth generation cephalosporin. Option B, it is active against many bacteria resistant to third generation cephalosporin. It is active against many bacteria resistant to third generation cephalosporin. Option C, it is active by the oral route. Option D, both A and B are correct. The correct answer for this question is D. Both A and B are correct. That is, it is coming under fourth generation cephalosporin. And option B, it's active against many bacteria resistant to third generation cephalosporin. That's the correct answer. That's option D. Now we will move to the 17th question. That is the last question of this video. Once this video is over, once this MCQ is over, we will discuss the important points also. The last question, the beta-lactam antibiotic that prolongs the bleeding time by altering surface receptors on the platelet is option A carbapenems, option B piperacillin, option C cefodoxime, option D both A and B are correct. The correct answer for this question is the carbapenems. Carbapenems, it causes prolongation of bleeding time by altering surface receptor on platelet. So these are the important multiple choice questions from this chapter. Now we will discuss the important points of this chapter. One is the classification of penicillin. Classification, mainly these penicillins are classified, especially semisynthetic class penicillin, semisynthetic penicillin classification. This semisynthetic we will discuss here. Semisynthetic classification. First one is acid resistant to penicillin G, that is option, the example is penicillin B, that is phenoxymethyl penicillin is coming under this class. Acid resistant penicillin, which is alternative to penicillin G. Next one is penicillinase resistant penicillin. Penicillinase resistant penicillin. Penicillinase resistant. They are narrow spectrum. Penicillinase resistant penicillins. Examples are methicillin, cloxacillin, decloxacillin, all are coming under this one. Third category, extended spectrum penicillins. Option, the examples are aminopenicillins like Ampicillin, Bacilli, Amoxicillin. Carboxypenicillins like Carbapenems D, uridopenicillins like piperacillin and mesalocillin all are coming under extended spectrum of penicillin. Now the last one, beta lactamase inhibitor, that one is clavulanic acid, sulbactam and tazobactam are beta lactamase inhibitors. Now we will discuss the cephalosporin generation. That's I already told in the 15th question how we can find out the generation by checking the name. For that one we have a trick. I will write it down here. For the first generation, they are classified into 5 generations. That's first one, second one, then third, then fourth, fifth. Like this 5 generations are there. The medicine coming under first generation all have, you have noted down this one, FA or PHA or PHRA. Out of this, any word will come under this first generation. Options, the correct this one options are, the example for first generation cephalosporins are cefazolin, cephalothine, then cephaloxime, all are coming under first generation. From there you can see that if you are writing that one, cephaloxime, PHA is there, then cephradine, Fra is there in between, then cephadroxyl, that is FA is coming in that. So by knowing this FA, PHA or PHRA, that will be first generation. Now the second generation, there is now we will move to the third generation. After last we will see the second generation. Third generation, in the name there will be IME or ONE or TEN. IME, ONE or TEN. Out of this, anyone will be there in the third generation. Examples are Cefotaxime, that is IME is there, then Ceftizoxime, IME is there, then Ceftriaxone, ONE is there, Ceftriaxone, ONE is there, then Ceftibuten, then 10 is coming in the last. So this is the third generation. Now for the fourth generation, there will be PI. Here the question, in the question, this 15th question itself, you can see what is the fourth. Select the fourth generation. I selected, this is Cefpodoxime. You can see here PI. That's PI is coming in fourth generation. Now the fifth generation, there will be ROL, ROL. Examples are Ceftibuten ceftobiprole, then ceftaroline. Okay, then another one is ceftobiprole. Here is role, here is role. So fifth generation, now we know. First generation we understood for PHA or PHARA. Then the third generation IME-ONA10. Then fourth generation PI. Then fifth generation role. These are the different generations. In the second generation, we have an exception. All other than coming under this one is second generation. Hope you understood. This is first generation, this is third generation, fourth generation, fifth generation. If any of this is not available, is not there, then it is coming under second generation. But there is an exception for second generation. One medicine is cefaclor, and another one is cefuroxime. Now you can see here I repeated cefaclor. You can see FA here. By this rule, FA, it should come under first generation, but this is an exception. You had by heart this one. Cefaclor is actually coming under second generation. The another one is cefuroxime. We know that IME is coming under third generation, but here is an exception. Cefuroxime is coming under second generation. So this is one of the good technique for easily understanding the medicine which generation it belongs to. Hope you understood this one very well, and if you like this video, please make thumbs up and also share with your pharmacy friends. Thank you.